Speaker, we see big increases. You noted, or I noted at the top of the speech, that our growth plan calls for a robust infrastructure investment program, and we followed through with that over our first term in government, and this budget is no exception. I think we're close to 8% increase in overall capital expenditures for the province, and so that means highways, and that means 2 new schools, and it means important healthcare projects moving forward. The hospital that members from Moose Jaw have been working so hard will go forward in that community. The Saskatchewan Hospital in North Battleford will continue to move forward. Mr. Speaker, we're going to get those pieces done. And in highways, we've seen just significant increases year over year. Another historic budget in highways, Mr. Speaker, because we understand that a growing province needs a good transportation system, and we're going to be continuing to invest in highways in Saskatchewan. So all of that within a balanced budget. All of it done balanced on the GRF side, balanced on the summary financial statement side, because we report in both, as we've already noted, as the ministers noted. We go that extra step of reporting in both of those areas, Mr. Speaker. So what have those who rate the fiscal probity of a provincial government, of any organization, what are they saying about the province of Saskatchewan? I'm always interested in what the finance critic and the deputy leader of the opposition has to say about the Minister of Finance's budgets. I enjoy the debates. They have good debates. Some of them are quiet and some of them are not so quiet. But I enjoy them. I like listening to his questions, and often he'll give his opinion on the budget, and that's important. That's part of his job. But I hope he's okay with the fact that when it comes to actually measuring the fiscal health of Saskatchewan, when it comes to determining the fiscal probity of Saskatchewan, that we would look to those who are in the credit rating business first before we might be listening to the deputy leader, as earnest as he is. That we might also look to advice from the economists at the various chartered banks in the country. So here's a few of them. The Bank of Montreal said, and I quote, "As expected, this is a largely stay-the-course budget with firm economic growth, persistent surpluses." Persistent surpluses. That doesn't sound at all like what the finance critic or the leader of the opposition just said. And yet this is an economist that's going to say, anyway, persistent surpluses and low debt levels. That also doesn't sound at all like the rhetoric we hear from members opposite. And the quote continues, "Saskatchewan continues to earn its AAA stripes, Mr. Speaker." And that, of course, is a reference to the fact that there's obviously credit ratings. Each province has a credit rating, and never in the history of Saskatchewan had we ever been AAA. Janice McKinnon, whom now the members don't like. They don't like Janice McKinnon. Janice McKinnon, I think, was in the 90s when all the provinces were dealing with big deficits. All of the provinces. We had one that was more acute here, absolutely. But when she faced that particular budget, Mr. Speaker, those series of budgets, she became the first finance minister in the Dominion of Canada to balance the budget in that era of governments trying to wrestle these fiscal challenges down to the ground.
Should be clapping now.
Yeah, they're not clapping now because they don't like Janice McKinnon anymore. Maybe it's because she was about balanced budgets. Maybe it's because she liked our surgical wait times initiative. I think it's because she thinks we should probably use private clinics within a public system if it actually lowers wait times. But not these fresh-faced new leaders of the NDP. They're here, they give speeches, and they absolutely want nothing to do with innovation in the healthcare system. They want nothing to do with what even Janice McKinnon recognized as important changes to deliver better healthcare within a public system. By the way, changes in terms of private clinics that are today in the province reducing wait times to historic levels, Mr. Speaker. They're not interested in that.